It's been a very hostile weekend for many of us, of course, the situation occasioned by the downpour in Accra. But of course, still, we have the grace to start a new week, and you're welcome to the AM show. My name is Pakwisi Shandov. This is the news. My name is Pakwisi Shandov. This is the news. Now, let's start off with the Kwame Nkrumah University, where researchers at the university have recorded alarming levels of antibiotics in soil and water sample at landfill sites in Kumasi in the Ashanti region. The findings established in the Journal of Chemistry revealed that concentrations of commonly used antibiotics such as penicillin in the soil and water at landfill sites are 1,000-fold higher than the acceptable limits. Medical correspondent Dr. Netta Pastram reports.
We simply asked a question: how do people in the communities dispose of unused or expired medications? Then we also went to the community pharmacists, because there are pharmacy shops as well, and we asked them the same question. If they have a stock of some particular medication and then that stock expires, for instance, what do they do to that?
The study sought to determine the levels of 3 commonly used antibiotics, metronidazole, penicillin, and amoxicillin in the soil and water found at active and inactive landfill sites in Kumasi.
So, consequent to our initial study, for the first study, as I had just described, our simple question was, what do you do to your unused or expired medications? And the majority of the people said that they put them into the trash. Once you put stuff into your trash, they find themselves into landfills or dump sites. And so we asked the question: if I take a soil sample from a dump site, or I take the leachate, the water that flows from these dump sites, if I take a water sample and I ask a simple question, how much antibiotic is present, what would I find? Interestingly, all 3 antibiotics were found in both soil and water samples from all, whether it was abandoned landfill sites or it was active. We found both penicillin, we found metronidazole, and then we found amoxicillin in those samples. The numbers were scary. According to world standards, if you find concentrations in the region of nanogram per liter, you should be scared. We found concentrations in the milligram ranges. A milligram is 1,000,000 times higher than that of a nanogram. And so these numbers are really scary. So we then asked the question: if we take bacteria from these abandoned landfill sites or these active landfill sites, if we take bacteria from there, and then we treat them with these same antibiotics that we found in that vicinity, what will be the effect? Will the antibiotics be able to kill the bacteria? Will it inhibit their growth, or will they be resistant to it? Interestingly, all the microbes that we isolated, all the bacteria that we isolated, were resistant to ampicillin. All of them were resistant to ampicillin. When we asked people how they dispose of unused medication, about 77% of the people that we interviewed said they just threw them into a trash. So just any dustbin, they just put them into it. About 77% of them just dispose them off that way. When we asked the community pharmacists the same question, more than 50% of them also said that they just dispose them through the trash. And that's scary if you think about what the consequences are on the environment.
One of the problems with how my antibiotics get into our environment is through disposal. So we are doing our disposal, doing it the right way, using the right systems to ensure that if it's medicines, they are incinerated or they are disposed in a particular way that it won't harm the environment. We are doing education like we are doing right now so that the public know. If you have a small shop somewhere, you know that please put a box in the corner, FDA would by all means be there. Put a box in the corner. You can make a list of that's the inventory I'm talking about. The number of medicines. Medicine A, I have 3 of them. Maybe they are the batch number, and probably the expiry. That's the manufacturing information. That is the manufacturing date and the expiry date. So you note all these things. When we come, we confirm the inventory and we take them. And 90% of the time, we don't need you to pay. We would ask you to pay, even if it's a small quantity, mostly when you need a distraction certificate.
The scientists attribute the unacceptable levels of antibiotics at landfill sites to the indiscriminate disposal by households and health facilities, and thus they recommend that regulations be put in place to curb this in order to avoid a public health disaster. Reporting for Joy News, Dr. Netta Pasram.